Hello, and welcome to today's Lunch and Learn, Men's Health, Stay in the Game. I'm Dr. Steve Reinches, the President and CEO of North Kansas City Hospital and Meritas Health. Thank you for joining us. Many men avoid talking about their health. Some think they can power through any ailment, which I don't advise doing. Men may not be aware that as they age, kidney function declines, prostate problems become common, and testosterone levels decrease. We're fortunate to have some of the best physicians in the city on our staff, and I'm excited to have one of them with us today. Dr. Mathew Strasser is an internist with Meritas Health, North Kansas City. He'll discuss the risk factors, preventative measures, symptoms, and treatment options for keeping a man's kidney, prostate, and testosterone levels in check. Dr. Strasser is a board-certified internal medicine doctor and a fellow of the American College of Physicians. He received his medical degree from the Kansas City University and completed his residency at the University of Kansas City, where he was the chief resident of internal medicine. Please join me in welcoming Dr. Strasser.
Thank you. So just to start off, I joined Meritas Health across the street as an outpatient internal medicine physician. I've been working for about 15 years total now. I did complete my residency training at the University of Missouri, Kansas City, including a chief resident year. I did graduate from Kansas City University of Medicine and Biosciences. It's now called Kansas City University. It's the osteopathic school here in Kansas City. I also got my bachelor's degree in nursing at the University of Missouri in Columbia. I'm originally from Gallatin, Missouri. It's in northwest part of Missouri. I'm married. I have 3 girls and I have twin boys on the way. So my hands are definitely full. So today we're going to talk about kidney health, prostate health, and testosterone. So first, kidney health. So I recently had to buy 2 strollers, 2 car seats, and I sort of thought about this. I saw this online and thought it was funny. We're going to talk about the kidneys. So the kidneys are 2 bean-shaped organs located in the back part of the body. As you can see on the diagram there, those 2 tubes connect from the kidneys to the bladder. Those tubes are called the urethra. So we'll talk about that a little bit later. They're about the size of a fist. The kidneys help filter extra water and waste out of your blood to make urine. That's their primary function. They also help with controlling blood pressure, making red blood cells, and keeping your bones strong. So with regards to kidney health, our goal is to avoid chronic kidney disease. So what medical conditions or what things can lead to chronic kidney disease? So the 2 big ones are diabetes and high blood pressure. Also, family history of kidney failure and people with heart disease can cause you to increase your risk for chronic kidney disease in the future. But the other problem with your kidneys are that as you age, your kidney function declines. So we have millions of nephrons in our kidneys, but as we age, our nephrons slowly die with time. I recently had a patient that was admitted to the hospital with a urinary tract infection. She had dehydration. She was around 67 years old, and her kidney function while she was in the hospital declined. Once she got out of the hospital, her kidney function improved back to normal, but as you age, these sort of insults to the kidney can take a toll. So kidney function is something you have to watch very closely. So what can help decrease your risks of chronic kidney disease? So as with many things, healthy food choices are important. Participating in physical activity to maintain a healthy weight. Getting enough sleep is important. Also, stress-reducing activities. I usually talk to my patients about this. This helps a lot of different medical conditions, but things like yoga, acupuncture. We actually do acupuncture in our clinic across the street. Also, meditation, I think, can be very helpful. There are different apps that you can load onto your phone and do meditation, which I've tried before and definitely helps. Also, exercise, of course, is a very good stress-reducing activity. Also, other things that can help. So if you're smoking, stop. That's, of course, important. Also, limiting alcohol intake. So it's really only recommended for women to have 1 drink per day or 2 drinks for men. This is equivalent to 1 12-ounce beer, 5 ounces of wine, or 1.5 ounces of hard liquor. I would say the most important thing, though, and a lot of people do have diabetes, high blood pressure, and heart disease. You have to sort of manage these conditions. See your primary care provider on a regular basis. So with regards to your diabetes, keeping your blood sugar in good control, making sure your numbers are well controlled, your hemoglobin A1C is well controlled. With regards to high blood pressure, keeping your blood pressure well controlled, making sure you're compliant with your medications. That's a big issue I see every day. And again, following with your primary care provider. And with regards to heart disease, making sure that you're taking aspirin and cholesterol medicine. Those are standard of care for anyone that has heart disease. So I get this question a lot: how much water should I drink? So I think this is a good diagram that sort of talks about that. So I talk to patients about taking their body weight, divide that by 2, and that's the approximate amount of ounces of water you should drink daily. So if someone weighs 200 pounds, divide that by 2, they should be drinking approximately 100 ounces of water a day. That's basically equivalent to the 2 44-ounce cups you get at Quick Trip, the biggest size. So I think that's fairly doable for people. Also remember, if you are exercising, which you should be doing, of course, you should add 12 ounces for every 30 minutes of activity. So what are the symptoms of chronic kidney disease? There really is none. That's the unfortunate thing. There are 5 levels of chronic kidney disease, stage 1 through 5, 5 being the worst. Unless you're at stage 5 chronic kidney disease, where your kidneys are basically not working. A lot of times when people are in stage 5 chronic kidney disease, they're not making urine. Unless you're in that stage, you really have no symptoms. So again, it's important to see your doctor, to have testing done. So there's simple blood tests and urine tests we use to check to see if you have chronic kidney disease and then monitor the progression. So blood test, we usually do a basic metabolic panel that checks the creatinine. It also checks the GFR, the glomerular filtration rate. That's an important test. And then the urine test, we use that more so in diabetes. This checks for the microprotein in the urine, which is helpful to check for the progression of your kidney function, especially when you have diabetes. So if you're concerned about chronic kidney disease, I would start with these tests. Ask your physician about them. So if you have chronic kidney disease, there are certain things that you should avoid. In general, I would say avoid herbal supplements or any type of supplement. The problem, I think, with supplements, and millions of people are taking them, but supplements are loosely monitored by the FDA, but we really don't know what's in them. That's the big problem. Also, many people are on multiple other medications, and the supplements can interact with them and cause problems with your medications working like they should. The other class of medications that can cause problems, cause progression of your chronic kidney disease are NSAIDs. So anytime someone sees a kidney specialist or a nephrologist, they always talk about NSAIDs. So these medications should be avoided. These are medications like Advil, Aleve, ibuprofen, naproxen. So these are all oral medications. Anyone that has chronic kidney disease shouldn't be taking this type of medication. There is a newer medication. It's over the counter now. It's a topical gel. It's called Voltaren gel or diclofenac gel. For my patients that I see that have chronic kidney disease that need some sort of NSAID for aches and pains, I usually recommend to take the topical gel, put it on their joints. Any sort of topical medication is safe because it doesn't really absorb into your bloodstream. So that's a good alternative for people that are looking for some pain relief. So if you have chronic kidney disease, there's a couple of medications that you should take or talk to your physician about taking them. So the first group of medications are ACE inhibitors or ARBs. This is a class of medication that it's been around for decades. These help protect the kidney. These are usually used when people have diabetes. So some of the common names are lisinopril and losartan. There's a newer medication out. It's a diabetes medication, but does have an indication now for chronic kidney disease. These are the SGLT2 inhibitors. These are medicines like Jardiance for Farxiga. This is a great medication and is to be used in conjunction with the ACEs and ARBs, but one of the problems with this medication is it is relatively expensive. So for people that can afford it, it's a great medication. Fortunately, the ACEs and ARBs, the lisinopril, losartan medications are relatively cheap. So that's something to consider. So next, we're going to talk about prostate health. I thought this was a funny cartoon. So the patient seems reluctant to get his prostate checked. So anyway, I would say as a primary care provider, we're sort of going away from doing the rectal exams or prostate checks. For most primary care providers, we're just doing lab tests to check for prostate health. So we'll talk about that a little bit later. So the prostate is a small gland in men that makes semen. That's its primary function. It sits low in the pelvis, below the bladder, and in front of the rectum. As you can see in that diagram there, it connects the bladder is above the prostate, and the urethra, which is the urine tube, sort of runs in the middle of the prostate and out through the urethra and out of the body. So when the prostate gets larger, it can sort of squeeze on that urine tube, and that causes a lot of problems for people that have benign enlargement of the prostate. So the kidneys, as they age, the nephrons die, and unfortunately the prostate, as you age, gets bigger. So that's one of the big problems with prostate. So the older you get, the more likely you are to have prostate problems. So at age 20, the average size of the prostate is approximately the size of a walnut. By age 40, the prostate grows to the size of a golf ball. And by age 50, nearly 50% of men start experiencing symptoms of enlarged prostate. By age 60, your prostate's approximately the size of a lemon, and by age 80, it's the size of a baseball. So we'll kind of talk about the symptoms now. So usually the symptoms, like I said, 50% of men at age 50 start having symptoms. Usually the first sign of prostate enlargement is frequent urination and increased urination at night. Increased urination at night is called nocturia. So usually the first symptom you'll notice is your urination more during the day and urination at night. It is normal to wake up at least once, maybe twice a night to urinate, but as you grow older, this may increase. The next symptom that people can have is difficulty starting a urination stream or weak urine stream. The next sort of progressing symptom can be dribbling at the end of urination. And then the next progressive symptom is inability to completely empty the bladder. Of course, some people are great at denial, and I've seen several patients in the emergency room where their prostate got so big that they can't urinate at all. That's when we have to put a plastic tube through the urethra, which isn't pleasant to drain their bladder. So these are all symptoms of, again, benign prostate enlargement. So I think this is a good diagram that kind of shows those things. So if you look at the picture on the right, as the prostate gets bigger, it sort of squeezes on that urine tube and causes a lot of the symptoms that I just discussed. So what do we do for benign prostate enlargement? So a lot of times, the thing that I do as a primary care provider is just sort of educate patients, tell them that their prostate is growing as they are growing older. Letting them know that it's normal to wake up once or twice at night. So another sort of educational thing you can talk to your patients about, or that I talk to my patients about, is decreasing fluid intake prior to bedtime. So once you drink a glass of water, it usually takes anywhere between 30 minutes to 2 hours for it to come out, So usually I tell my patients to wait at least 2 hours. If they're having issues with peeing at night, to sort of stop drinking water or any fluids 2 hours prior to bedtime. So those are kind of easy ways, sort of some behavioral modifications that can help with nighttime urination. Of course, when patients become concerned, when they're waking up too often at night, it bothers their sleep. The next step would be medication. So there's two big different types of medications we use for enlarged prostate. So sometimes I'll start patients on my own on those types of medication. Also, you can when people have enlarged prostate, we can send them to see a urologist or a prostate specialist. For severe cases, at times, patients do need surgery on their prostate. Sometimes they resect the prostate or decrease the size of the prostate if medications don't work. So that is an option. That is something that the prostate specialist or urologist would do. So prostate cancer, one of the other big issues with your prostate is prostate cancer. Typically, prostate cancer screening starts at age 50. For those that are higher risk, like African Americans, that can start at age 45. Kind of like I talked about earlier, our primary test to screen for prostate cancer is called the PSA. This is a blood test. Some people still do rectal exams. I think that's reasonable. Me personally, I don't do them on a regular basis unless someone's having prostate-specific pain. Really, to get a lot of good information from that, you should be doing rectal exams on a regular basis. So I think that's sort of going away in the primary care setting. Certainly, if you see a urologist, they'll likely do a prostate exam. But PSA is a proven, easy to get blood test that we can obtain to check for prostate cancer. Usually, it's all based on numbers. Usually anything below 4 is normal. Anything between 4 and 5 is sort of in the borderline range. And any PSA level above 5, is an automatic referral to the urologist or the prostate specialist. Usually the next step is a prostate biopsy. And then depending on what the biopsy shows, sometimes patients just sort of watch and wait with their urologist following their PSA levels, depending on what the biopsy shows. The other options, of course, for prostate cancer is sometimes people can have their prostate removed. Sometimes people have radiation. There's also hormone therapy. The good news about prostate cancer is sometimes it's really slow growing, other times it's aggressive, but there is a lot of treatment modalities out there for prostate cancer. Prostate cancer is relatively, from a cancer standpoint, it's not a death sentence. There are a lot of treatment options, even with people with widely metastatic prostate cancer. But again, this all starts with getting a PSA checked and seeing your primary care doctor. So other prostate problems. So besides benign enlargement of your prostate cancer, people can have acute or chronic bacterial inflammation, or what we call prostatitis. This is usually a bacterial infection. We usually treat this with antibiotics. There's also another condition called chronic prostatitis, or chronic inflammation of the prostate. This causes chronic pelvic syndrome. Both of these conditions are relatively rare. If you have any questions about this specific issue, usually if patients have concerns, I'll usually send them to a urologist, or if it's an acute prostatitis, I'll just start them on antibiotics and monitor how they do. So again, how do we prevent prostate problems in general? Exercise is important, maintaining a healthy weight. Prostate cancer, who's most at risk? So African Americans are most at risk for prostate cancer. That's why we start screening them at age 45. Asian Americans, then Caucasians, and then Native Americans are least at risk. But again, everyone should start at age 50 unless you're African American. So should I take supplements? Again, I would say no. Like we talked about before, very loosely monitored by the FDA, can interact with your other medications. In making this presentation, I looked up to see how many supplements there were for the prostate alone. I mean, there's hundreds. So there's a big push. If you go to a health foods store, they're going to push this on you. Again, I would suggest not doing this because you really don't know what's in them. So the last topic we're going to talk about is the testosterone. I thought this was funny. I found it online. Except for his testosterone level being out of whack, Frankie's a normal 7-year-old. Testosterone, what does it do? It helps with muscle strength, sex drive, and bone strength. As men get older, it is normal for these levels to decrease. And when levels of testosterone get too low, men can have symptoms. So there are certain medical conditions that are associated with low testosterone. So HIV being one of them, end-stage kidney disease, or patients who are on dialysis, moderate to severe chronic obstructive lung disease, which is also called COPD. Of course, if men are infertile, they can have low testosterone. Any man that has osteoporosis should be screened for testosterone, especially in young men. Anyone that has diabetes type 2 should be screened for low testosterone. And then medications. So people that are on chronic steroids or narcotics or other narcotic pain medications should be screened for low testosterone. So I think this is the most important slide when we're talking about testosterone. When should we replace it? So symptoms. So you need to have symptoms of low testosterone: fatigue, decreased libido or sex drive, depression, reduced muscle mass, enlarged breasts. This is basically describing everyone, though, as you age, are going to have these symptoms. So this is also called male menopause, these symptoms. So 2 issues with this: as you age, you're going to have these symptoms, but these symptoms could also be due to low testosterone. So the key is not only the symptoms, but you should be checking your blood work. Testosterone levels. So we usually do total testosterone levels on 3 separate occasions in the morning. If you do them later in the day, they can be higher, and it's not an accurate test. So this should be done anywhere between 8 a.m. and 10 a.m. in the morning, and have 3 done on separate occasions that show low testosterone. So why don't we treat everyone? So why don't we just give testosterone out? Because people are having symptoms. The problem with testosterone replacement is that there is a link between testosterone and prostate cancer. There's a link between testosterone and prostate enlargement. Testosterone can also cause increased blood clots in the body. This is from an increase in their hemoglobin hematocrit. Testosterone can also cause cardiovascular issues such as heart attack and stroke. So if you don't have low testosterone levels via getting your blood work checked, you shouldn't be replaced due to these side effects. So testosterone replacement, there's been a dramatic increase in the last 10 years of healthy middle-aged men taking testosterone. So this is a lot of direct-to-consumer advertising. I listen to a lot of sports talk radio. There's commercials every day about testosterone replacement. I watch a lot of sports on TV. You see these commercials on TV about testosterone replacement. Eugenics is a common one now that has these retired baseball, football, basketball players talking about Total T. Their advertisement is, are you getting tired? Are you getting fat? Are you losing muscles? Problems in the bedroom? Then take our supplement. Again, this is not, I don't think is safe due to the issues like we talked about with prostate cancer, enlargement of the prostate, clots, and cardiovascular issues. So I'd be very cautious in taking these medications because they probably do have testosterone in them and they will increase your levels, but not in a safe way and is not indicated for someone that doesn't actually have low testosterone. So again, kind of talking about this issue, the other sort of word that you can hear with low testosterone is called low T. One of the other problems with taking testosterone is once you start taking testosterone, once you stop the medication, sometimes people have to stop either due to the cost of the replacement medication or, you know, they're sick and can't take it. Once you start taking testosterone replacement, your body stops making testosterone on its own. So once you stop the medication, then you really are truly going to have symptoms of low testosterone at that time because it's difficult for your body to start making it again. And then also over time, as you're taking testosterone, it can decrease production of sperm and testicular size. Replacing testosterone. So let's say that you have symptoms of low testosterone, you get your blood work done between 8 and 10 in the morning, and you have 3 separate low testosterone levels. So the most common replacement is, there's 2 forms. So a daily topical gel, this is called Andor gel. You use a patch, you place it on your skin once a day. The other option is a weekly subcutaneous injection. The daily topical gel, I think, is probably the easiest method to replace. One of the downsides of taking it this way is that it is relatively expensive. The injection is cheaper. The problem with the injection is it does come in a vial. You have to pull it up in a syringe and you have to give yourself the injection or a family member. So a lot of people don't like doing it that way. So it is important to, once you start testosterone replacement, to have your PSA monitored 3 to 6 months after initiation of therapy. Kind of like we talked about, it does increase your risk for prostate cancer. And then also having your blood counts monitored 6 months after initiation and every year to monitor for increased blood counts, which can lead to clots. So thank you.
Well, that's a great presentation. So there's some questions from the audience, if you would be available to take a few.
Sure.
So our first question is, I get up often in the middle of the night to urinate. How many times is too many times? You mentioned it's normal for men to get up once or twice in a night, but when should they seek your attention?
I think it really depends on the person. If you know, you get up once or twice and can fall back to sleep easily, then that's probably okay. Some people, you know, they get up one time to pee and then they can't fall asleep again for 2 hours. You know, so really has to do with their sleeping habits. So, you know, is your sleep being affected by how many times you're getting up to urinate? And also depends on what sort of symptoms are you having. Are you just having, you know, increased urination, or is it harder to start and stop your urine stream? So, but it really depends on the individual, and, you know, is this really affecting your sleep? And then are you sluggish during the day? So
Well, that's good advice. Here's another question from the audience. Is it okay if I see a little blood in my urine?
I would say, no. Anytime someone sees blood in the urine, that's called gross hematuria. This isn't really associated too much with prostate problems per se, but yeah, anytime you see blood in your urine, which is called gross hematuria, you need to see your primary care provider and probably a bladder specialist, or like we talked about, the urologist. And a lot of times they'll test your urine again, and then sometimes they have to put a camera up and kind of look around in your bladder to make sure there's nothing going on there.
So just to clarify, gross hematuria it's not revolting hematuria. It just means that
Yes,
there's so much blood in your urine that you can see it with the naked eye, rather than a microscope.
Yes, I should have clarified. Yeah, gross hematuria just means that you can see with the visible eye blood in the urine, which usually means a lot of times people can have the urine doesn't look red, but it does have red blood cells in it. But when the urine has enough red blood cells in it and you can see it, that usually means it has a lot of blood in it. So that's more significant, I think. So
Yes. So here's another one. You talked about surgery as one of the treatments for benign prostatic hypertrophy. Can you go through the merits of surgery versus the merits of taking medicines?
that's a good question. I think it ultimately depends on how severe your symptoms are. You know, if people are having a hard time, I think, you know, we talked about the severity of symptoms. So if you're just having increased frequency of urination and urination at night, that's relatively managed by medications. But if you're having a hard time starting or stopping your stream of urine, if you're having dribbling, obviously people don't want to have dribbling for hours after they urinate, which sometimes people can have. Or certainly if they're having a hard time starting their urine stream and it becomes painful, then those more sort of progressive symptoms of benign prostate enlargement, that's when I would say surgery is a better option.
So here's another question, and I want to kind of refer to your talk. You mentioned going to a vitamin or nutrition store and buying testosterone tablets off the shelf. Is there some step before that? Is there any way to naturally increase your testosterone, either by activity or by just natural food, just food that you would get at the grocery store?
So there's no way that I don't know of any way to just sort of naturally increase your testosterone. I think some people, when they hear the word natural, they think of supplements, and they think I can take a supplement to increase my testosterone. But again, a lot of those supplements actually just have testosterone in them, and I think that's not a safe way to replace your testosterone, because you need to know if your testosterone levels are actually low before you start taking a testosterone replacement.
So if you're feeling that fatigue and loss of muscle mass, go to your doctor,
Yes.
get a real test,
Yes.
and confirm it in a real test.
Yes.
Okay. Well, here's another one. I heard the phrase during your talk of male menopause, that's in quotations. Is that really a diagnosis, and can you describe again what that is?
So it's not a real. I don't think you could say it's a real diagnosis. I do think male menopause are the symptoms of low testosterone, such as fatigue, loss of muscle mass, enlarged breasts, but all those symptoms, happen as you age, regardless of your testosterone levels. Sometimes it is because of low testosterone, but other times it's just as you age, you have decrease in sex drive, fatigue, those types of symptoms. So it's the way to figure out what it is to get your testosterone checked.
Great, great. Well, that's a great presentation, and I want to thank the audience for joining us today. We hope Dr. Strasser's presentation was both informative and helpful. The good news is that there are many things men can do, including making their health a priority with regular wellness exams that are available through our Emeritus Health primary care practices. You can find one at nkch.org/primary care. Please join us on Thursday, April 14th for our next Lunch and Learn presentation, Medical Weight Loss, Explore the Benefits. And the presenting physician will be Brianne Kelly, who's our medical weight loss physician with our Total Weight Loss Center. Again, thank you for joining us and have a good afternoon.